Hello. Hello. Good morning.
Hey, how are you?
I'm well. How about yourself?
Good. Can you hear me?
I can hear you great.
Good.
No,
I'm
thank you
so
so
glad. I'm so glad my lawn guy just finished blowing the leaves.
It's Murphy's Law, right?
Right, exactly.
Well, I'm so glad this worked out and it's been a long time coming. So I thank you for your patience and all the rescheduling that I've had to do.
Sure, no problem. My
Thank
schedule
you.
changes hourly, if not by the minute.
Absolutely. So we'll probably spend maybe about 30 minutes or so if that works for you.
Yeah,
And I try to keep it unscripted. I'd like to just get to know you and a little bit about what it was like growing up as you and kind of influences shaping your career choices and of course just the perspective being a woman in two male dominated traditionally male
yeah.
dominated fields and we'll try to make it conversational and keep it fun.
Okay, sounds good. What's your specialty?
So I did a sports and arthroscopy fellowship in Richmond, Virginia, actually.
Okay, great.
And I understand you do hand, right?
Well, I did. I retired
Oh, okay. Okay.
4 years ago,
Oh, okay. Okay.
and just coincidentally, the state senator in my district quit to run for
Right.
Congress and left an open seat. So
Ah,
I tried to retire, but it didn't work out that well.
gotcha. Yeah, I was going to ask you if you were navigating both simultaneously, but that's great. I want to make sure we kind of keep things kind of
Yeah,
fresh, and so
yeah,
we'll get into it once we officially start. So I'll
yeah,
have if it's okay with you, I was going to just kind of draw from your bio online
yeah.
for my intro, unless you have anything else you want to add to that.
That's fine.
And I will record that separately. And then I'll be introducing you and then we'll just dive in.
Okay,
All
perfect.
right. Okay. All right. We'll pause for 1 second and then we'll start.
Okay.
Oh, before I officially start, how would you like to be addressed?
People ask me that all the time, and I'm a senator for now, but I'm always a doctor. So the doctor trumps the senator, in my opinion.
Okay. So I can call
People
you
people call me
Dr.
Dr. K, whatever.
All right. Okay. So if that's okay, then I'll refer to you as Dr. K.
Yeah,
It has
that's
a good
good.
ring.
Yeah, and then is there video or there's just
No,
audio?
it's I keep the video in my archives, and every once in a while I'll like splice together just a little preview, but it's going to be audio. I I end up running out of time
Yeah.
and I don't end up doing the video, and so it is first and foremost an audio
Okay.
production. So
Great.
okay, we'll pause and then we'll start. I'm so thrilled to have you here with us, Dr. K, today. I'm so lucky to get to talk to a fellow orthopod and trailblazer. So, welcome. Thank you so much.
Delighted to be here with you.
I always like to kind of go way back with my guests. And I know from reading your bio and learning a little bit about you that you did your undergrad at UK, you did your medical school at University of, well, we say here on the West Coast, Louisville, but I know there's the right way to say it, right?
Yeah. Yeah, we say Louisville.
There you go. I didn't want to butcher it. So we know that much about you, but I would love to hear what your early years were like as a child growing up. Tell me what that was like, and who was really influential in shaping who you are today in your childhood years.
That is really a fun story for me to tell because my parents were a very traditional family, blue collar. My dad worked for the L&N Railroad and was transferred. We moved around a lot. And really, nobody in my family had ever gone to college, and certainly no one had ever been in healthcare. And so my dad told me when I was young, uh, it's America. If you work hard, you can set your goals high and achieve whatever you want. And even if you're a girl. So I kind of took that to heart and ran with it. And I had planned to, we grew up kind of on a farm, but I planned to either be a nurse or a veterinarian. And sometimes I think veterinarian would have been a good choice, but I had a dermatologist that went to my church when I was in adolescence. And, like many other adolescents, I was seeing him for breakouts on my face. And he asked me what I was going to do. And I told him, and he says, well, why don't you just go to medical school? And I said, okay, sounds good. I like people and science, and it seems like that would be a good fit. So I just decided in high school, I guess, that I would go to medical school. And that's what I did.
I hear a common theme among so many of my guests. Women on this podcast are all trailblazers in a way, and really are doing well in fields that traditionally don't have a lot of women. And one common thread is that at a very early age, they are told that they shouldn't be held back from what they want to do simply because of gender. And so it really just showcases how important it is to start planting that seed to kids, no matter how young they are. It sounds like
Yeah.
that's what your dad did.
Yeah, he did. And, the thing that I tell young women, and I do a lot of mentoring because that's super important, because I didn't have really any female mentors in my profession because there weren't any. And what I tell people is I just always tried to get there earlier, be more prepared, work harder, be the best at whatever I was doing. And that's how you are very likely to be accepted as equal, even if you're not recognized as being the best. But there really are no shortcuts there. And I never thought that anybody owed me anything. Mm-hmm. So that sort of traditional work ethic, I think, takes you a long way.
My kickoff intro to this podcast is always a favorite of mine because I get to talk to my fellow orthopedic surgeons. And, I'm curious. I know that you've kind of had just kind of multiple different phases of your career, and now you are in the state Senate. But I'm interested in knowing how that seed got planted to think about orthopedics as a profession.
There are two different parts of this. One is the orthopedic part, and one is the leadership part. So I'll talk about orthopedics first, because I really didn't decide to do orthopedics until the very last minute. It was the last rotation that I did before I had to decide what to do. And those residents were having so much fun and really seemed to enjoy what they were doing. And I've always liked working with my hands. And it just, it's open to taking care of people of all ages, all walks of life. And I really like the variety a lot, and the idea that you can fix something. So surgery, as you know, there's a divide in medical school about surgical or procedural-based specialties versus more cognitive specialties. And I knew right away that I wanted to be in a surgical specialty. And interestingly, at the University of Louisville, where I did my residency, well, medical school and residency, they had a great hand surgery fellowship there, Dr. Kleinert's program. And I rotated through that program a number of times while I was a resident, and even once as a medical student. And so I fell in love with hand surgery early on and knew from the beginning that that was what I wanted to do. The leadership part, you may want to talk about that later, but I started down that path in high school, and was president of my class and president of my medical school class, and got involved in the AMA, for example, as a medical student, mm-hmm. and just sort of continued down the track of being engaged and involved because it directly impacted what I wanted to do. And it's a cliche now, but if you're not at the table, you're on the table. So mm-hmm. I really have enjoyed that part of my career, and ended up being president of my large orthopedic group along the way. which was really a great experience.
And do you think that in the evolution of your career, both clinically as well as building your leadership skills, your leadership style, is that how you were led into politics on a more broader level?
I think that's how it ended up, but that was not my intention ever. In fact, I used to have terrible stage fright, but to the point where I took Enderall when I was performing a solo music, which I did a lot in my younger years. And then the AMA sent those of us in the student business section to public speaking training and a lot of other leadership stuff. And I really got hooked on it. And leadership development has become a big part of what I really enjoy in my life. And so I read incessantly. I think there's a lot. I don't think you have to be born a leader is what I'm trying to say. I think you can learn skills that can help you. And I'm fortunate enough to be an extrovert, so it's easier than if you're an introvert. But a lot of those skills sort of developed through my career. However, I've always felt that humility was a large, very positive trait for leaders. And unfortunately, in politics, it's hard to get elected if you are a humble person. And so that has been a big hurdle for me to make that transition in self-promotion, because I like working behind the scenes. I don't care if I get the credit. And I think that it's been an unnatural thing for me to get into a world where it's all about promoting yourself.
And I can imagine that when you need to reconcile that trait of humility with the need to be able to promote yourself and your skills and what you can do for your constituents, that imposter syndrome has to come up from time to time. Have you experienced that?
You know, I don't know if it's genetic or what, but I've never really had that.
That's great.
I've always wanted to be treated fairly, and I've never really gravitated towards being involved in a lot of women's organizations, because as an orthopedic surgeon, I want to be recognized as an orthopedic surgeon, male, female, whatever. And the same thing in the political world. So I've never really thought of myself that way. I have felt like I've worked my tail off and I've earned every single thing that has happened to me. I mean, there's some luck in there too, no doubt. But I understand where that comes from for people who didn't get that strong message early on, that you can basically do and achieve anything you want to do. So that's why, again, to just repeat what you said, young women, girls need to get that message that they're entitled as a human being to be rewarded for their efforts.
Have you ever had any moments where you said, whoa, I have made it, I'm finally here, or just kind of those wow moments where you find yourself in a situation where you just didn't imagine yourself there if you were to look back?
You know, I sort of pinch myself still every day to, I'm so grateful for living in a country where it's the land of opportunity, and where under the law, we can achieve things. And we don't have an authoritarian government that's telling us, no, you have to stay home and you can't go to school and all that. But yeah, I think the one time that I really sort of realized how lucky I've been is in the Georgia Orthopedic Society. I was president for a year, and I thought I was the first woman president of that group, but it turned out there was someone in 1954, a female, wow, during the polio times, who was married to another orthopedic surgeon, and they practiced at Warm Springs at the where President Roosevelt went for his treatment. And they gave me an award, which was, it wasn't that year, but a year or two later, recognizing my contributions to the field of orthopedics. And that, I think, was when I sort of realized that I was the first woman in my program and the first one and, lots of other things. And so I'm very happy to look back and realize that now I have the opportunity to help other people, other women, other minorities, other men, whoever that need a boost or need someone to talk to about the challenges that they face. And I really count that as a blessing and something that I really enjoy a lot.
And I think you bring up a really good point about bringing people into the conversation that are not just part of one group. I think about that a lot as a woman in orthopedics. As you know, the 6% name of this podcast is inspired by one of the recent figures of how many women practice in orthopedics. But I agree with you in that, I think if you carry on the conversation of bringing in more representation, more diversity and equity within our field, and you keep that conversation within just a certain subgroup and don't engage the men and people in all different groups, that we end up kind of sitting in an echo chamber.
Exactly.
So I'm curious, at the time of your training and when you came out into practice, right now 6% is what it's quoted as. What was it at that point?
I'm not sure I know. I think at that time there were 250 female orthopedists in the United States.
Yeah.
And so that was around, I started residency in 1981. Mm-hmm. And so that's a long time ago, but I was really fortunate to have had a chairman for at least the first year. We changed chairman a few times while I was there, who really explained a lot of things to me, like, if you really have to pull that hard, you're probably doing something wrong. And very supportive in helping me navigate. And so, yeah, some of the guys in my year were kind of big football player types. And I learned a lot about leverage and doing things a slightly different way. And so I've had some great mentors myself, primarily men, because like I said, that's what there were. But to be given a chance to prove myself and then to take that ball and run with it, because I didn't expect anybody to give me any special treatment. And I didn't have my kids. I didn't get married and have kids until after I was done with my training. And so I know that's a big issue for a lot of people, because that does impact how you fit into a residency environment. And in my practice, once I got started with that, I was in a small setting initially where it really impacted somebody else, mm-hmm. how much time I took off when I have my kids, for example. And so it's all about timing and where you are in your life. Same thing's true in politics. The time is either right or not. And so I spend a lot of time talking to young people who are physicians, who are somewhat interested in politics, and kind of talking them through, is this the right time? Is this a good idea? What are the barriers that are going to be in your way? And maybe it's not the right time, but so I know everybody makes different choices and you end up where you are by just a confluence of events. But for me, I really have, like I said, had kind of a charmed path. I went a straight path. My kids start talking about a gap year. I'm like, what is a gap year? So, I just went straight into practice, straight, and had no idea that when I retired, I'd be an elected official.
Tell me how that came about. We were chatting a little bit before we went live about 4 years ago now that you thought you were going to, retire from orthopedics. And so how did that transition occur?
Well, I had already decided that 30 years was a good number to step aside, do some more things I wanted to do, work on my golf game, travel. We've got a second home that we like a lot and a huge families on both sides. But when the state senator in my district decided to run for Congress, I started getting phone calls because it was really exactly the same time that I was retiring. And people knew that I had a background in leadership and also had done a lot of advocacy work on behalf of my group, on behalf of orthopedic surgeons, the whole time I've been in practice. And so, not knowing any better, not really understanding what was involved in being a candidate and then being a senator, I raised my hand, said yes. That's one of the things that you can argue about whether it's good or bad, but through my life, I've said yes to way more things than I probably should have. But I encourage young people to say yes also, because now I need to practice saying no. But earlier on, there are lots of opportunities that if you don't take them, you're going to miss something important. And so I said yes, and it's been a very big challenge. The campaign was a big challenge. I ran against 7 other people. 3 of us were doctors, and then ended up winning and having to be in an election the following year, and then election last year. So basically, you're running all the time if your term is every 2 years. But I just thought I might be able to make a difference because healthcare was kind of a hot topic. It always is a hot topic. And in fact, I've been able to be very effective in the legislature on behalf of patients and physicians. And that's really the only reason that I'm there, because people are like, do you enjoy this? I'm like, no, not really, because it's not about me. If I can't get stuff done, that's the mindset that you come with if you come from the outside world, if you come from healthcare or you come from business. And if I can't get stuff done, why am I there? So I am now retired, sort of. And so I don't know how to work part-time because I worked 2 jobs my whole career, being an orthopedic surgeon and running my group. And that was a big job. So I kind of wake up on go and work on policy every day. And because of that, I'm able to get a lot of things done. But, it's all about communication and relationships in the legislature. And believe it or not, doctors are really good at communication and at relationships because we live that every day. So we've now got 5 doctors in the Georgia legislature. 4 of us are in the Senate.
There are a lot of translatable skills, I think, going, that aren't always immediately apparent. Like you say, we have to take something that is complex that we study for years and years and be able to translate it to your average layperson so that they can understand and make an educated choice about their healthcare, about the surgery that they're going to have. But what do you think on the flip side of that, shifting from being in orthopedics into politics was the biggest mindset shift that you had to make? What was the biggest adjustment that you had to make?
Well, when I went and met with the governor right after I got elected, I said, look, Governor, this is how I do things in my world. I ask all the right questions, make sure I've got the right diagnosis, get the right people in the room, talk about all the options, pick one and go. And then we just do it. And he started laughing. I thought he was going to fall out of his chair. He said, I think you're going to find that's not how it works down here. And he was absolutely right. If something's a good idea, that really has no relation to whether it's going to pass or not. So it's not just about the policy. There's all these relationships that come into play, people that have a history with each other, people that I don't even have time to get into all the push and pull that goes back and forth, but it's not all partisan either. It's sometimes just somebody didn't vote for your bill, so you don't want to vote for their bill, and that kind of stuff. It's kindergarten stuff. And I don't like that, but that's, I spent a lot of time reading bills in my office when I first got down there. What I should have been doing is going and sit in somebody's office and chatting and building a relationship, because that's really where the money is down there, is people building a trusted relationship and a credible relationship with people. And in the business world and healthcare, you kind of assume that, but in politics, you can't assume that. And then the other thing that in healthcare, everything's positive, and your patients like you. If they don't, they go somewhere else. your staff likes you by and large, your peers, you get along. You get down there and people are yelling at you. And I'm in a swing district, so we have to vote red or green. There's no maybe button. And so if I push green, all the red people are mad at me, et cetera, et cetera. So it's a daily thing to get negativity. And I've never really had negativity in my life. I mean, occasionally you'll get a patient who's mad at you, or you get a bad result or whatever, but this is a whole different swimming pool. And I'm getting used to it, sort of, but it's still, I did get rid of my Senate license plate recently because I don't like driving around my community and having somebody stop me at a red light to give me a piece of their mind. So
when all you want to do is go get groceries.
Yeah. So it's very different than and I know everybody's beat up in healthcare right now. And somebody told me over the weekend, they hate the word burnout. They wanted to say something different than that because burnout somehow implies that you're a failure somehow. I had never really thought about it that way. But even if you're tired in healthcare and beat up, you still have this tremendous privilege of connecting with people on a level that doesn't happen in very many other professions. And you make a difference multiple times every single day. Yeah. And that is such a gift. So I hope that all my orthopedic surgery friends realize that, because it didn't become that real to me until I left, until I wasn't doing it anymore. But it's a great privilege. And I hope that people can get some satisfaction out of that.
Absolutely. So you have worn so many hats over the years. You're a parent, a surgeon, a leader, you're a senator. You have done so many different things. In the last year, I wanted to just get your thoughts on this. I think, in the pandemic, we have started to see women who have full-time careers, who have professions, who are also parents, end up taking a lot of the brunt and double duty, triple duty with the, I know your kids are young adults, but with the women professionals who have kind of the younger school age kids in the home now doing school from home, I think it exposes a little bit of sometimes societal expectations of kind of who takes on what. What are your thoughts on this? And can you also share how through the years, and of course this past year and a half has been just unprecedented, but through the years, how did you navigate kind of juggling all those roles, including parenthood? And before you answer, I will add that I always feel funny asking the question, because it's not like we go around asking the guys, hey, how are you a surgeon and a parent? The women always get this question, but I think it's, I like hearing what our guests have to say.
Well, I mean, if you go all the way back to navigating pregnancy as an orthopedic surgeon, that's a can of worms right there, because the lead doesn't always, not all the aprons are going to fit. And I worked up until the very end and came back 6 weeks later, because that was the standard in my day. I know it's changed now, but I married a physician, an emergency physician, and that is both better and worse, because we both understand each other's challenges, and yet we were both working full time. And so the good news about that was we were able to afford to have live-in help for the first 5 years until both kids were in school. And that was very helpful. Once they were in school, we could juggle. And I think my husband kind of backed off on his hours at that point. But things are a lot more egalitarian than they were when I was growing up. And so I think it's easier to work those things out. But I think you can't do it by yourself. You've got to have some help and figure out how to do that. And the other thing is that you can't have it all. And you can do a lot of different things, but you're going to miss stuff. And I'll never forget being in a board meeting and getting a phone call that I didn't take the first time. And then the second time I did. And my son, who was playing Little League Baseball, had just hit for a cycle. I don't know if you know what that means, but it means he hit a single, a double, a triple, and a home run in the same game. And I was at a board meeting and not at the game. My daughter broke her arm at after school. We were both at work. They called me. I said, is she crying? I didn't know her arm was broken, but they said, no, she's not crying anymore. I said, okay, well, go ahead and send her to after school and I'll be there as soon as I can get there. So she was in after school for a couple of hours before I could see my last patient. She's still not over it. She gives me a hard time. I mean, it's funny now because she had a wrist fracture and ended up later having to have a closed reduction. But, you just can't be everywhere at the same time. And I think you have to learn to give yourself some slack. Yeah. And there are some times that you have to miss board meetings or whatever. You have to miss, you have to rearrange your surgical schedule depending on what's going on. And that's just part of it. So if you're trying to balance all those things, you're going to miss some things and you just have to get over it.
Yeah. Yeah. We have to give ourselves some grace, I think, sometimes.
Agreed.
Absolutely. And so much of what you say just resonates with me as well. My son's 9. And so, it's just takes a village and I know you have 2, right? I only have 1. And it's still, it's just, it takes a village. You gotta have the good help, with helping to care for your child when you're at work and I rely on my friends a lot.
Yeah, well, I sort of forgot to have kids. And so my first one I was 37 and my second one, I was 39. They're only 16 months apart because the clock was definitely ticking at that point. And so we were well enough along in our careers that we could, like I said, have options for childcare, which was great. But it's a lot of work and I don't think I even went anywhere or did anything other than what I just had to do for the first few years when they were small. Yeah. But, they don't seem to have suffered. They're both in their late 20s, both employed, both happy, and they don't appear to have suffered. And sometimes I think I spent more quality time with my kids than some of my neighbors who don't work at all spent with their kids because they were, well, I won't go there, but I think I was really focused when I would get home on the kids. And that's what you have to do. The downside of that is, and my husband was too, you got to guard your marriage because, that's the part that gets pushed aside. And then right behind that is you taking care of yourself, which is at the bottom of the pile. Yeah. And I think there's consequences to that. And so that's just a piece of the puzzle that needs to at least be in the puzzle.
Yeah, absolutely. It's like you got to put your life vest on first so that you can take care of those around you.
That's right.
I love it. Great advice. What kind of advice do you have? If you had one big piece of advice for somebody who aspires to follow in your footsteps and achieve some of the things that you have, what's your biggest single piece of advice for that person?
I would say never give up. I mean, I think people who are willing to put in the work and to not expect anything to be handed to them, I think the sky's the limit about what you can do. And I'm always willing to help people that are coming along who want advice or help or whatever. I don't know everything by a long shot. I've done a lot of things wrong through the years, but I think just being determined and just knowing that you're just going to keep pushing forward and no matter what happens is the thing that I learned sort of in my family as a young kid. And that has really stuck with me.
That's great advice. Well, Dr. K, it was so nice to have you on with me today. And I know our listeners are going to love this episode and look forward to it kicking off the rest of the season.
Great. And then if anybody wants to talk to me, you can put them in touch with me.
Absolutely. Where can our listeners find you online?
Um, I probably my Senate webpage right now is the best, which is at senate.ga.gov, and they can look me up on there. And I'm also in the AAOS directory and also in the Hand Society directory. So I'm pretty easy to find.
Wonderful. Thank you again.
Sure thing. Thank you.
All right. That's a wrap, as they say.
Okay. Great. Very good.
I so loved listening to your story, and I think my personal path as far as just sort of timing and having kids a little bit later was very much paralleled, and even just kind of deciding to go to medical school. I was thinking, oh, maybe I'll go to nursing school, I'll go to PA school. And I had just one person say to me, why not go to medical school? You're smart enough, you can do this. And I was like, oh, I just didn't think of it. And I too had my son at 38. Was I 38? I was almost 39. So, and like you, I think very, very lucky to already be practicing. And so had full-time nanny and then live-in au pair. We have a live-in au pair now. And it's just been necessary to be able to do what I want to do professionally. So,
well, we didn't really, I was kind of glad we didn't really get into too much to COVID, because I can't even imagine trying to do all that now.
Yeah.
Because the people that were living help for us were not equipped to fill that learning role. And I just don't know how people are getting through it, but it's so political right now. And I did a video last week that was just sort of trying to be a common sense voice, saying, look, this is where we are. These are things you can do. Nobody has to tell you to do them. And it was pretty well received. That's but good. I did get beat up a little bit, which everything I post, I can post something about it, rescuing dogs, and somebody will jump on there about elections or who knows what. But anyway, you got to have a sense of humor about it somewhere along the way.
That's true. Absolutely. Well, it really was a pleasure. Thank you. I'm sorry you interrupted.
No, I was just going to ask how you've managed.
Well, they just told us that our electives are on hold at the hospital, but I think that as beds become available, they're allowing kind of on a day-to-day basis whether we can proceed with the inpatient surgeries as far as that goes. And fortunately, I think this time around, because so much of my work is at the ASC, I do a lot of cuffs, I do ACLs. We're not running into as much of the PPE urgency, and so we're still carrying on with surgeries. And when we had the shutdown last year and things really ground to a halt, that's how I ended up launching my podcast, because I was thinking of doing it. And I'm like, well, I don't have time. And now all of a sudden I was like, oh, I have a lot of time, and no one else is doing anything either. But I think we're not in a better place now, but we're in a different place, at least as far as clinical practice goes, but.
Well, I think we should have been doing telemedicine
to start with.
We should have had that option all along, but it's inertia. Nobody wanted to go there because they were just used to doing things the way they always had done. And so I think we've learned some things that are beneficial.
We kicked off the telemedicine, we did quite a bit of that. And even when, earlier this summer, when things felt like, so much more normal here in Portland, at least, with just our office being fully open and surgery schedule being full, I never stopped doing the telemedicine. I think it's going to be part of my practice, because I have people coming in from the coast 2 hours away just to have me talk to them about their MRI. And now we can do it on the computer and screen share, and I can show them what's there. And there, I would say, the majority of folks are really grateful to save a trip in, where sometimes I'm running late, they can take the call at work. So that I think that'll stick around for a long time.
Yeah.
It is for me, at least.
So
Yeah.
silver lining
Silver
to that
lining.
super big cloud. But
Yeah.
I had COVID in March of last year.
I saw that on your site, your bio, I think.
Yeah,
Yeah.
but the good news is I'm in this antibody study, and
Oh.
I had antibodies for really 9 months to the point where I
Huh.
could give plasma, which they're not really doing anymore.
Yeah.
And then when I got my first vaccine,
Uh-huh.
the antibodies went back up to where they were right after I had the virus. And the second vaccine, they doubled. And
Really?
so I get blood drawn every 3 months. And
Oh, okay.
so my antibodies are still good. And my vaccine was
Yeah.
in February.
Yeah.
So I'm
Interesting.
sure at some point they'll recommend a booster, but
Yeah.
I'll be there with my sleeve rolled up whenever they say that.
Well, thank you again for your time, and I'll keep you posted. I am working on one more episode for this mini season. I'm doing a mini season of 6 episodes plus this one, just to get another season out, because I have all these other projects that I'm working on. So I said, well, it's my podcast. I'm going to make it shorter.
Do you listen to a lot of podcasts?
I do. Yeah, I really started to listen to a lot more podcasts. It just seemed like a great way to multitask while I was exercising or driving. And I love audiobooks too.
I listen to books more, but while I was driving to a meeting on the Georgia coast this weekend, I listened to a podcast that someone had recommended called Dr. Death.
Oh, I've heard of it, but I haven't listened to it yet.
Oh my gosh, it's terrifying, but it's
yeah,
fascinating in a way.
yeah,
So
yeah. That's on my
anyway,
list.
I think podcasts are good because it's shorter
Yeah,
than a book. So.
easily digestible.
But anyway, I hope to meet you in person one of these days.
I do too. Are you going to be at? Do you go to Academy?
Um, normally the Academy is in the middle of our legislative session.
Yeah.
This year, what's the date this year?
It starts in a week.
Oh wow. No,
Yeah.
I didn't.
Not this year.
I
Yeah.
couldn't do it this year, but I do like it and I want to go back again. But as long as I'm in the legislature, it's going to be tough because it's right in the middle of it's usually the first quarter that we're in session. But I am going to the Hand Society meeting this year.
Oh, okay.
They asked me to give a talk on advocacy or something. Okay. So my son lives in San Francisco. So that's just perfect.
Well, I do hope to connect in person someday, but look forward to staying in touch, at least digitally.
Yeah, well, I'm easy to find. So if there's anything you think I can help with in your world, let me know.
I appreciate it. Thank you. Take care.
Take care, Nancy.
Bye-bye.
Bye-bye.